Okay, so we're taking good notes, and I may give a quiz at some point today. Just keep that in mind. Any notes you take, I'll probably let you use on that quiz. So, radiation units and measurements. So we're going to talk first about some of the concepts behind taking measurements. Okay, so anytime you take a measurement of something, you have to put a unit to it, right? Like if you measure distance, you have to measure it in feet, or you can measure it in inches, which those are convertible units, of course, from the same system of measure. But you can also measure units of distance in things like meters or millimeters. So we have different standards for measurement. Okay, so in science and medicine, units, especially radiation units, are now being measured in what's called the System International, or SI units. And the way to think about that is SI units are the metric units of measure. So they'll fit in just fine with things like the meter, the liter, right? The gram or kilogram. We actually use those same numbers when we use radiation measurements. So we're going to measure we're going to want to be able to measure four basic things. Okay, we want to be able to measure radiation exposure. So that doesn't imply that you've absorbed any radiation, that you have any kind of dose, but it's there to measure. Okay, we want to be able to measure radiation dose. That implies how much radiation you actually received, how much your body actually received. When you think about dose, think about it like medication, right? Medications are always dosed. A certain patient gets a certain amount of medicine. When a doctor gives patient a medication, do they give it to them by accident? No. So they give it to them on purpose, right? It's purposeful administration of something, right? So when we say dose, we mean purposefully administered radiation, right? For the purposes of achieving diagnostic x-rays. Good morning. But that's not the whole story, right? I can know how much radiation you've received, but I may not know the exact amount of biologic harm caused by that radiation. So we also need what's called dose equivalent. And lastly, all the different body tissues are differentially sensitive to radiation. That means, for example, if you're and it's hard to just isolate the nervous system, but if the nervous system, let's say the brain, is exposed to a certain amount of a certain type of radiation, it's going to react differently than if you had exposed somebody's ovaries to a certain amount and a certain type of radiation, same amount, same type, right? The body's going to react differently depending on what type of tissue is irradiated. So we also need to take into account the type of tissue. That's called the effective dose. So we're going to walk through all four of these, make them as easy to understand as I'm able, and I do encourage you to stop, ask those questions when you have them.